Knee pain. So many of us deal with it, right? But what if I told you the way we've all been taught to treat it is, well, kind of wrong? Today, we're going to talk about a real solution that goes way beyond just covering up the pain and actually gets to the heart of the problem. Okay, let's jump right in. You know that feeling, that little twinge, that dull ache in your knee after a long day, or maybe a move you shouldn't have made. We've all been there. But have you ever really stopped to ask yourself, is it just an ache? Or is it something a whole lot bigger? Because, you see, for a lot of people, that little ache doesn't stay little. It grows. It becomes this constant thing that stops you from playing with your kids, from taking a simple walk, or even just getting up the stairs without wincing. It can honestly feel like your life has hit a full stop. And that feeling, it pushes so many of us into this incredibly frustrating, endless cycle of pain. It's a loop that's really tough to break. And if you've been there, you know exactly what I'm talking about. So here's how the cycle usually goes. Your knee starts hurting, so what do? You reach for a painkiller, maybe you rest it for a bit. And yeah, for a little while, the pain quiets down. You think, phew, I'm good. But then it always comes back, doesn't it? Sometimes even worse. The reason is so simple. You've only been silencing the alarm bell, you haven't actually been putting out the fire. So, what if we changed our whole approach? Instead of just trying to manage the pain, what if we actually focused on solving the problem that's causing it in the first place? It's really time for a new way of thinking about this. And that's where physiotherapy completely changes the game. See, this isn't about just masking the symptoms. Not at all. It's a science-backed approach that zeroes in on the actual root cause of your pain. And that, right there, is the huge difference between a temporary patch and a real, lasting solution. Okay, so how does it actually do that? How does physiotherapy get right to the root of the problem? Let's break down exactly how this super effective treatment works. All right, first up, a good physiotherapist is going to work on strengthening the muscles around your knee. We're talking about your quads, your hamstrings, even your calves. When these muscles are strong, they act like a natural brace, literally taking the pressure off the joint itself. Then they work on your joint's mobility with special exercises and hands-on therapy, which gets rid of that stiffness so you can move freely and smoothly again. Next, physiotherapy actually helps your body heal itself, which is pretty amazing. They use techniques like ultrasound therapy, that's just using sound waves, or something called TENS, which uses a really mild electrical current to bring down swelling and inflammation. This gets your blood circulating better, which means more oxygen and nutrients can get to the damaged area, helping your body repair itself way faster. You know, what's really interesting is that sometimes the problem isn't even the knee itself, it's how we're using it. A physiotherapist is like a detective. They'll analyze the way you walk and sit to find any little patterns that are putting extra stress on your knee. Then they help you correct them, which stops the pain from ever coming back. So we've gone over the how, which is super important, but now let's get to the best part, the why. What are the big picture, long-term benefits that make physiotherapy such a total game changer? I mean, just look at this. It really lays out the two paths you can take. On one side, you've got the short-term fixes, like painkillers. They just cover up the symptoms, which means the pain is guaranteed to come back. But on the other side, you have physiotherapy, which is all about fixing the root cause, giving you relief that actually lasts. It's like the difference between just patching a leaky pipe over and over again, or actually calling a plumber to fix it for good. And here it is. This might be the biggest benefit of them all. By getting to the root of the problem early and making that whole support system around your knee stronger, physiotherapy can, in so many cases, help you completely avoid major surgery, like a knee replacement. It puts the power back in your hands. So after all that, what's the big takeaway for you? What's the one thing you really need to remember from all this? Let's boil it all down. This is it. This is your roadmap to relief that sticks. Physiotherapy isn't about symptoms. It's about the cause. It builds you a natural support system with stronger muscles. It gets you moving again without stiffness. It kicks your body's own healing process into high gear. And maybe most importantly, it's a powerful, real alternative to going under the knife. So I'll just leave you with this one last question. It's really for you to think about. When it comes to your health, your future, and your ability to live a full, active life, what are you going to choose? A temporary fix that keeps you stuck in that cycle? Or a permanent solution that sets you free? The choice is all yours.